My name is Dr. Rahul Mehra. I am the CEO and Chief Physician Executive for the National Center for Performance Health. We are an organization that focuses on optimizing human performance. As a board-certified child, adolescent, and adult psychiatrist for over 30 years, our current organizational focus is on helping employer groups, professional athletes, and other high-performing individuals, such as collegiate athletes, as well as K through 12 schools. In particular, I am currently on the medical staff for the XFL. And recently, given the events of what is happening in our country, I wanted to offer some tips related to our professional staff, coaches, and athletes themselves. You can well imagine that as any other profession is enduring currently, they have had their schedules disrupted, their jobs essentially disrupted because seasons have been canceled or postponed. The ability to work out in training facilities has been disrupted. These are all disruptions that impact our day-to-day lives and the day-to-day lives of the athletes and the coaching staff themselves. So what can we do? What should they do? What should you do if you are a professional athlete or a coach? Well, first of all, you definitely need to take a step back and take a minute to reflect. Reflect on your past accomplishments. You have certainly achieved this status of being a professional athlete because of the accomplishment of goals, of perseverance, of enduring significant life events, whether they be personal or professional, such as injuries. At those points in time in your past, you were able to cope, you were able to persevere, you were able to get through it. And you're going to get through this as well. And it's really important to look beyond the next 30 to 60 days to see what the end is in sight in terms of the season returning, of your passions returning. Here are some very specific tips. Change your thoughts. Number one, turn the negative thoughts into positive, optimistic thoughts. Number two, count on support from friends, family members, other teammates, whoever they may be. Maybe it's spiritual leaders, maybe it's someone in your synagogue, maybe it's someone in your temple, maybe it's somebody at church. Reach out to people that you have social connections with. Also, be mindful and watch the amount of alcohol you're consuming. Please do not allow this to increase compared to normal times. This probably isn't the best time to start cutting down all your alcohol intake. You certainly don't want to drive impaired or engaging in poor judgment activities, but be aware of that as well. The other thing is follow up with your physicians. If you are taking any prescribed medications, make sure that you have ample supply of those. In particular, for those of you that may have existing psychiatric conditions, please ensure that you have enough of your medication, that you're following up with your providers. Touch base with them if you need some extra support right now. It's okay to do that. We are all enduring this stressful time together. In some sports, athletes have been, quote, sent home, and many of them haven't been home for this particular time of year since they were teenagers. So now we have to readjust to being at home. Use that time to be with your families. Use that time to reconnect with friends from high school, physicians, athletic trainers. This is what feeds our souls at the end of the day. Yes, your identities are very much tied into your athletic identity, but not even because of this most current event, but even looking forward. Find a way to figure out balance in your lives. Volunteering, thinking about others, serving others. Yes, you may also be incurring some economic consequences because you're not getting paid right now. Figure out some solutions for that. Contact your team and your organizations. Community resources. You may have children at home and may be really asking yourself, what do we do? Well, one thing you do is you be a model for your children. There's a concept known as social referencing. Children learn how to deal with adversity by observing their families and their parents. Be a model for them. Be positive, be hopeful, because they are picking up on your emotional cues. Children by nature are extremely resilient. However, if they see that their parents are struggling, then that potentially has the consequence of having a negative impact on them. And certainly we want our children to remain healthy during this process, because one way or the other, school is going to come back into session, rest assured of that. Activities will resume, and that's what we have to teach our children. And one of the great things about children that they are excellent at is staying in the moment. And that's also something you can do, is to stay in the moment, right? You all are mentally tough. Use that mental toughness to persevere through this. So I think that's why it's important to take this time to also talk about how you're feeling. I call it the trifecta. Find 3 people in your life who you are close to, who you can have trust in and confidence in, that are not going to violate what you share with them. Talk openly about your feelings. It is when we keep these things inside that we get into trouble. It deters us. It gets us off track. The mind is very naturally oriented towards negativity. There's actually a term for it. It's called automatic negative thoughts. You can use the acronym ANT to remember it. You have to practice consciously being hopeful, being optimistic, and being positive. There's a lot of negativity in the air right now. We have to change our way of looking at this and focusing on the positive, in that we are going to get through this. After all, we are the United States of America. We are powerful in the world of athletics, and we will return, and you'll return.